Oh my gosh. Oh, this endless question of health insurance. I mean, this is just barbaric that we have to ask this question. It's so stupid that we have to have a single person that doesn't have health insurance. It's just absolutely ridiculous. It's ridiculous.
I live in New York City. I live in New York City. I live in New York City. Yeah!
I would say the majority of the people that I know don't have health insurance. A lot of people are on Medicaid, and a lot of people just give fake names at the emergency room.
I had some doctor friends that would help out a little bit sometimes. Yeah, it's kind of a mishmash of handouts, who you knew, and city-based public health services. Yeah, but mostly I just tried not to get sick or hurt myself.
I tried really hard not to get sick because I didn't have health insurance, and so, I would take it easy. If I got a cold, I wouldn't go out, and I'd bundle up in bed and try not to. And luckily, I have a dad that cares about me a lot. So if I were to get sick, I would use an emergency services provider and kind of pay as I could and try to piece together health insurance here and there.
You can sustain yourself when you don't have insurance and you get hurt. I don't have insurance, but I know who to go to when my knee's hurting or what herbs I need for indigestion or whatever. And it won't necessarily be the Western doctor, and it won't necessarily be a clinic.
I'm probably in the minority. Most of my friends wanted to be taken care of with health insurance. I just didn't get what the big deal was. I just think that the makeup and the fabric of an artist doesn't think first about, am I going to be okay, and where's my health insurance? I feel like that's sort of not the impulse of an artist. I'm extremely proud of offering that to my dancers. I don't ask them to pay a substantial percentage of it because I know what that's like. They're not gonna. And I wouldn't want them to use their money that they use for their life on something I promised them.
Really interesting.
Here we go.
That's great. So, health insurance. I do not have health insurance, and I really should because I am a single parent. I'm also a diabetic. I tried to join the freelancers union, but you have to make a certain amount of money like within 6 weeks, and I was like $100 under that. And I make a little too much money to qualify for a lot of the free, stuff that's out there. And it seems like right now you're either really, really poor or your life fits into some sort of box. But, we have to jump through a lot of hoops just to get by in this city. That's why everybody lives like they're a college student till they're 58,
I decided I wanted to just play music. I didn't want to have another job. I didn't even want to teach music. And by doing that, I make so little money that I do qualify for Health First. So I'm on that program at the moment. It's great. And the people there are actually really easy to talk to, and they are very good at following up. They call me to make sure that I go in for a checkup.
In order to have health insurance over the years, I actually have done something that I haven't really wanted to do, which is do commercials. Chewing on a Snickers almond and going, that's yummy.
My health insurance from Actors Equity will lapse in April, and I don't have the weeks to cover the next year. And sometimes you're thinking, well, I can make the weeks by doing this, but it's not a play I really want to be doing. I meet a lot of young actors who say, oh, it's not a concern because they're young, but there are accidents that happen. One of them broke his collarbone, not on a set when you're covered, but, riding his bike down the street, and there was no coverage.
I do not have health insurance right now, and I don't know what I'm going to do or what I want to do with that. And I don't trust these companies. I don't know if I want to give $200-300 a month for, but what if, God forbid, something happens to me?
I still believe that that insurance should not be tied to work, and I think that will solve a lot of problems if it's based either on income or it can be out of a tax or something. But it's basing from work, especially like knowing how people switch jobs so often. It just doesn't make sense anymore.
I'm a PhD candidate in performance studies at NYU, and have been for a really long time, and basically am continuing along that process so that I can keep health insurance.
In Canada growing up, of course, healthcare is a government-run system, and I believe deep down that healthcare should be a universal right, and we're on our way there. But knowing that that wasn't the case when I moved here, that I would have to have a full-time job. So that's what I've been doing. My healthcare premiums at my job have gone up double, triple in the last couple of years. I'm happy knowing that those people outside of the full-time system will be able to purchase healthcare. So it's worth it to me, and I hope eventually we get there.
New York City. I live in New York City. I live in New York City. Yeah.